Hey, what's up, everyone? We're gonna get started here in like 3 minutes. In the meantime, I'm going to drop a poll in the Zoom. If you could please fill it out, I'd really appreciate it. And see you in 3 minutes. All right, what's up, everyone? So, welcome to another free weekly Zoom. So today we're gonna do mental health. We're gonna do some topics that are super high yield, but not only are we going to go through those topics, we're actually going to go through practice questions next gen. We're going to do next gen practice questions, but these are not practice questions you've seen anywhere else. These are brand new, a bow tie, a case study. If we get time, maybe a traditional one, maybe an order type question. But we're gonna do some super high yield stuff. And these questions literally were just made. They're made to, we're hoping to have a Q bank sometime in 2024. That is part of our course and or something you can do on your own for questions that are like how I think. Those of you that are students of mine, you know how quickly I come up with questions and people are like, whoa, I saw that on the boards. I saw it on the boards. So with that said, I know a lot of my students are like, why don't you have a Q bank? We're working on it. So these questions are made by me. They are board style questions. They are next gen, bow tie, case studies, so on and so forth. So with that said, couple of things. Thank you for the belated birthday wishes. I appreciate that. But before we get started, we have a couple of people that made it to the other side. And we do have Nurse Megan, where are you at?
Hi, Dr. Z. Hi,
Hey,
everyone.
Nurse Megan. So we have, let me take off this shared screen real quick so we can get, there we go. So we have yet another pass. I feel like every single week, day, whatever it is, we get another email or text from you saying, hey, guess what? I got another pass. And I'm just like, at this point, it's just like, I feel like Nurse Megan is just copy and pasting that sentence to me. So, Nurse Megan, who's your student and where is your student at?
Yeah, it's Nurse Ebony. Hi, Nurse Ebony.
Hello there. Can you hear me?
Yep, I can hear you. How are you?
I'm good. Look, still in shock, but I'm doing well.
Good. Awesome. Well, congrats again. So if you want to tell everyone what you used of Nclex High Yield, if you don't mind, how many attempts this was for you, and then what advice you can offer to those that haven't gotten to the other side yet.
Okay. So I have some quick notes for you guys. Of course, I wrote them down. If I could tell anyone anything, you need to do Nclex High Yield for sure. That is number one. But this was the 5th attempt for me. I did 3 attempts with the regular standard version before April. And then my 4th attempt was doing next gen. I had went all the way. I didn't know what to expect, so I went all the way to 145. And I was like, I don't know if I did it or not. But a friend told me about Nclex High Yield. And back in June of 2023 is when I just went all in. I kept practicing. I did the Zoom just like everybody else was doing the live class. I followed Dr. Z's method of doing everything, Ask, Scrap, Ash. I did the tutoring. I did the studying where you would do the 440s. Sometimes it was hard, but if you do that, you will pass. I knew the first time that I passed, you guys, I would reach out to Nurse Meg and I will let her know I'm a little bit nervous, but she's like, you got it, believe in yourself, and I would email her. But the tutoring really helps, especially if you like doing one-on-one, and you just have to be confident and you need to read the material. Like Dr. Z would say, read the material, read your packet, do everything, just follow everything and watch and see how you advance with your scores. I did really good with my scores. I stopped at 85. And when I stopped at 85, I was nervous because I was like, oh my God, it's just going to send me to a break or whatever. But I was actually really done. I was done in an hour and 30 minutes. But
wow.
If you know Ask Graph like the back of your hand and Ash, you will do well. And Dr. Z and Nurse Meg, I just want to tell you guys thank you. And thank you for being there for me. Thank you all of you. I want you guys to and you get to there. And I hope you guys have really happy holidays.
Oh, thank you so much.
Thank you. So proud of you. I knew you could do it.
Yes, do the tutoring. If you struggle, do the tutoring and don't stop. Watch the videos 4 and 5 times because I think I watched it 10 times.
You beat my record.
Yes.
Well, congrats. I'm so proud of you and have a great holiday.
Thank you. Congrats, Miss Ebony.
Hi, Dr. Z.
All right, so yet another pass from Miss Megan. Again, all this stuff, look, none of us are here to none of us are salespeople. We're in the medical field. Doctor, nurses, whatever education that we have behind us. We're not out here to do anything but to help make a difference. We find more joy and satisfaction in helping people pass their boards and changing their lives than most of us who have already worked. Nurse Brittany has worked, Nurse Megan has worked, I've worked in the field. And we decided, well, saving lives and changing lives are both equivocally important to us. So absolutely amazing. Congrats again, Nurse Megan and Nurse Ebony on that pass. Nurse Josh, where are you at?
I'm right here.
Yeah, what's up, Nurse Josh? How are you?
I'm good.
All right. So Nurse Josh, what of Nclex high yield did you use?
So it took me 4 attempts to pass.
Okay.
My second and third attempt, I used your free Zooms, and then
Okay.
after the third attempt, I got the full course with the on-demand videos, and after I finished the course, I watched all the videos 3-4 times, and then I passed with the next gen Nclex, and the course really made the difference for me.
Yeah, absolutely. I mean, and you'll see this kind of as a common theme, and I'm talking to the people that are not crossed over to the other side yet, Nurse Josh, but for those of you that are in the journey of passing, if you notice, Nurse Megan, Nurse Ebony, Nurse Josh, they all said that they've watched the content multiple times. This is not an easy exam. It's not an easy subject. So Nurse Josh, what is your advice for people on the other side?
Yeah, my advice is, keep up with content, keep doing questions. It doesn't really matter too much what QBank you use. I switched with Archer and UWorld. It didn't make too much of a difference, but it was the Nclex high yield videos that I watched them all over and over. I'm a big music guy, but I kind of stopped listening to music. I was just listening to your podcast in the car over and over again, and just, kept going through it on my way to work, on my way to my friends, just whatever it was, just kept listening to them.
Yeah, it's kind of funny because I come from a music background, a big time music background. And for me, music is something that I can't be without. But when I was studying for boards, I was the same way. I was listening to podcasts and lectures and things, whatever I can get whatever my program provided me at that time. So that's amazing. So what are your plans right now, Nurse Josh? What do you got planned?
Yeah, so I'm actually at my last day of my old job right now. I'm going to be applying to a couple of hospitals nearby. I have friends I graduated with who are already working there, so I'm hoping to be able to join them and work as a floor nurse.
Nice. Well, this is something that we offer any of our students that have taken the live course. We do offer letters of recommendation. Obviously, I'll be your personal reference. So these are things that we definitely offer to our students that have taken the live course. It's just one more added benefit when I'm able to see you all throughout the course. And with that said, how many questions are we, Nurse Josh?
So this time with the next gen, it was 125. I had 6 case studies, so it was really heavy on that. I had 6 of them, and the last one was a really difficult cardio one. So when I finished that one up, I felt like I was in good shape because I'm like, it wasn't AFib, it wasn't, CHF. I'm like, okay, I think I'm in a good spot here.
Right. What's it called? Definitely. Well, cardio, you know how big we go in on cardio. And yeah, but as we're gonna learn today, case studies are just an elaborated version of the 5 types of questions, right? So, and we teach you all the test taking strategies. But with that said, Nurse Josh, congratulations for getting over to the other side. And
thank you for all your
sharing
help.
your story with us.
Yep, thank you.
You're very welcome. You're very welcome. All right. And then we got, last but not least, Nurse Lindsay. Where are you at?
Can you hear me?
We can. What's up, Nurse Lindsay?
Okay. Hey, how are you?
Doing well. So, Nurse Lindsay, what of Nclex high yield did you use? Clearly, you're running a course.
I was in the online course, and I mostly got it to learn, face to face, obviously, and then also in addition having to watch those videos, and I watched those videos over and over and over and over and over again because the thing about listening to you and listening to the other nurses, it just connects. I used Archer as well, but I didn't know if I could believe that my scores were true. So I just stuck to your method. I stuck to, give them what they don't have. And I'll tell you what, that was burned into my brain. So when I took the exam, I was like, because when I took the exam, it seemed like almost like it wasn't real. Like it was like, are they really giving these obvious, blatant answers?
Yes. Yeah. Now, I want to kind of elaborate on that because yesterday we had a pop-up tutoring, and in pop-up tutoring we do a specific subject, and then we go through and answer questions. Those of you that were in the pop-up tutoring, it's so funny because when we learn a topic and then I ask the questions, they're like, they're not going to be that easy on the boards, and I'm like, it's because you know your content now. So it's, and you're like, is this really that easy? And I'm like, it's not easy. You just know it now.
Yeah, I literally was just like kind of like looking over my shoulder, like this can't be real. Like, you know, I don't want to say it's easy. By all means, it wasn't. I put in the work. I even rescheduled my exam because I was so uncertain whether or not I should, you know, take the next step forward and just take it. But then I just kept getting really high reviews, and then I just felt really good I felt really confident, like being like that. And then also being in your class online, you guys gave me the confidence, I guess, that I needed in addition to. So, and now I just feel really confident talking to patients every day. I'm still looking for a job, but I work the VA as a tech. So I work with them every day, which just kind of like solidified everything that I do. But like, absolutely. I was just talking to one of the doctors the other day. I was like, did you know about Apixaban?
Yeah.
And so the factor at like, you know, all of that stuff is great, you know?
Yeah.
So.
I love your sweatshirt, by the way.
Oh, thanks. I had to represent
Nclex high yield. We got a lot of gear out now too, which is super cool. But with that said, how many questions were you and what attempt were you?
First attempt, and I have 85 questions, but I
one
also
and done?
had
six case studies.
Yeah, one and done.
Yeah, one and done, 85 and out, 6 case studies, which is about 36. If you do 36 of the one, when they approximate, you're going to do it the whole test. 36 about 1/5. So we're looking at about what 20+% now, 20 to 25% of the exam is going to be case studies. But again, the case studies are still the 5 types of questions. So with that said, what is your advice for people on the other side, Nurse Lindsay? And we got you a letter of rec, right? We took care of that?
Yeah, just yesterday. So I appreciate it. Thanks for doing
that. Cool.
Yeah,
make sure that you got all that taken care of.
I will say that in my exam, I had every patient demographics from NICU all the way up to older men's health and older women's health. I had everything. So, but it's everything that you've covered. And then at the very tail end, there was some random thing that I think maybe it's not really covered, and it's also not high yield. So you know, like I said, like it was about BPH, but no big deal. I focused on all your high yield. So that's what I would say with everybody that's going into the course is just like, because I had guns loaded, ready to answer all those cardiac questions. And I'm not, to be fair, I did have some, but I only had like 2, and then it would switch to something else. It went from all the body systems and all the patient's demographics you can think of. I had 2, okay. I know you're doing today, and I had 2 depression mental health questions, or 2 case studies, older men's health with depression, and then a teenager. And at the end of the day, they're questioning who a safe nurse. That's really the source of what they're asking.
No, so, absolutely. And that's kind of, you know, what we teach. Like, we don't know what we're going to get, but if we cover everything, it's definitely, you know, you'll be good at whatever they throw at you. So with that said,
I went through all of your stuff, and that's my best advice to everybody is just to keep going through it and listen to it when you're driving to work or wherever you're going. Listen all the times, you know, because the podcast, the YouTubes, the videos, if you have them, like, just because it's be instinctual.
There you go. With that said, Nurse Lindsay, thank you so much for sharing your your journey with us, and congrats. Clearly, I'm trying to get out of Vegas, but nonetheless, congrats on that, and thank you so much, and good luck. Keep us posted. Cool?
I will.
All right. Take care. All right. With that said, let's get started on some mental health topics. Really, really high yield topics. I would like you to take notes on this because this is really important stuff. Real quick, we do have some stuff because obviously we don't have a live course going on. The live course starts in January. It is on sale right now for $4.99. It's probably the cheapest that we've ever seen in the last 2 years. So $4.99. Again, there's a lot of benefits from it. We will be doing a Q&A next week if you have questions regarding the course coming up. We do have our rapid review, which is about 10 hours. It's to kind of give you a taste of what we do, or for those people that are on a time crunch as well too. It's only $99.99 of pre-recorded content that we've picked out for you along with notes. We've got the full on-demand course on sale for $359.99 if you want to do it while we're getting ready for the live course, or if you want to get all that content that students were talking about as well too. Again, we got a bunch of free resources right here. Scan that in your phone. YouTube, follow us. Instagram, follow us. Facebook, follow us. TikTok, follow us. There's so much great content that we put out on those platforms, and they're all free. Podcast, everything as well too. Again, thank you for supporting our podcast. Thank you for supporting us and spreading the word. We really do appreciate it. It's phenomenal to see what type of a community that we have built. Again, if you need funding, then look out for, Google some community organizations, religious organizations, cultural organizations. You'll find so many places that will help out and will provide all the paperwork that they need. Also, be aware of scammers. I'm not on Discord. I'm not on WhatsApp, Telegram, Zelle, Cash App, none of that stuff. So make sure that you're not falling for those. We've had some horror stories with people that are getting scammed out of thousands and thousands of dollars. But with that said, our first topic that we're going to talk about is a case study. So with this case study, the way that it works is that we've got a progress note. We got some lab results that are going to be on the left side of your screen. There are different tabs. So this one is a progress note, and we look at it and it says the nurse is caring for a 35-year-old male, and they are in the emergency department. Okay, 35-year-old male in the emergency department. Let's figure out what's going on. Let's figure out what's going on here. So we're at 0100. So we're talking about what time? What time would this be for those that don't know military time? What time is this? It's 1 a.m., right? This is like going into like late night into the early morning. And the client is brought to the emergency department after being found agitated, anxious, and diaphoretic. Okay. A lot of things that can cause that. Client is displaying muscle aches, restlessness, and tremors. Okay. Still not very specific yet, right? I mean, right now, our mind is kind of thinking all types of different things, right? It's not necessarily specific yet, but we're starting to think, okay, this patient is uncomfortable, agitated, anxious, diaphoretic. All right, let's move on and find some other clues in here to figure out what our potential differential can be. Because again, I've been teaching this since before Next Gen, right? Those of you that have been with me before Next Gen, or those of you that have seen the way I teach, I've taught from day one, know your differential diagnosis. This is real life. This is what the boards are starting to ask now. On arrival, the client complains of abdominal pain with nausea and diarrhea. Okay. Still not very specific, but we're getting more and more clues to build our scenario. Medical history includes chronic back pain from 15 years of working in the construction industry. Whoa, okay. Why did they give me chronic back pain and construction industry? Okay, now I'm thinking what? NSAIDs, okay. Cancer, okay. I could stretch it to cancer if they were to get some sort of like asbestos, or they were doing sandblasting. Okay, I would even maybe something like that. Pain meds is a big one. Opioids is a big one as well too. Let's continue on. So you see how everyone's starting to think. This is how you're going to do your case study. The client is reluctant to disclose what medications or drugs are being consumed. Whoa, okay. Why? There you go. You ask yourself, why are they hiding it? The client lost their job a few months ago. Do you think they have insurance anymore? Do you think they have the means, the financial means to pay for it as a cash pay patient, let alone to even get into the doctor? Okay. See, now we're starting to piece together the puzzle. All this is we're thinking about this individual and their specific situation and what it could possibly lead to. Now we keep going. Physical examination shows dilated pupils, mild jaundice, and track marks on arms. What is the situation here? Vital signs, blood pressure is 150/90. Good. Nurse Kareem, it's not use. It is withdrawals. It's withdrawals. And we'll go through this. How do we know? We'll go through it. Blood pressure elevated 150/90. Heart rate, tachycardic respiratory rate on the higher end, temperature 100. But wait a minute. Is this use? If they were using opioids, would they have dilated pupils? No. If they were using it, would they be agitated or would they be euphoric? Euphoric. Would they be anxious or would they be relaxed? Would they be diaphoretic or would they be cold? Would their muscles be in pain or would the pain be taken away by the opioids? Would they be restless or would they be chilling and relaxed? Would they have tremors or would they be just fine? But they lost their job. For 15 years, maybe they had justified opioid use and they were prescribed it. And now depressed could be in there. Depressed could be in there as well too. But we're focusing right now, not because again, we're focusing on what? We're talking about withdrawals, right? We're talking about withdrawals. This person, this client was unable to potentially see the doctor, was unable to go to probably pain management, which I can only imagine the copay is ridiculous. Then on top of that, or not the copay, sorry, cash pay is ridiculous. The pills itself are going to be ridiculously priced. And now they've probably developed tolerance. If they've lost their job, do you think that they're more apt to taking that medication more frequently now because they're at home? Yeah, because it gives that euphoria, right? So, well, I'm coming off of it. Well, I don't got to worry about work right now. So let me just pop another pill, right? So yeah, maybe they're starting to take it more and more. And now they lost their job a few months ago. So what is another opioid that's cheap that they can now get off the streets, relatively speaking? Heroin, right? Heroin, heat it up in a little spoon, take a syringe. We talk about syringes and dirty needles. Where do we talk about that in? Those of you that are in the course, those of you that have the on-demand, where do we talk about that? And bacterial endocarditis. Good job. Excellent job. You see, I just tied this way back to cardio. I took mental health and withdrawals and addiction, and I switched it right back to cardio. You got to know. You got to know. All right. Now let's look at the lab results. CBC, the complete blood count is normal. Liver function test, they have elevated AST, ALT. So, of course, we're talking about that mild jaundice. But then we do a UTOX, right? They're coming in, they're agitated, they're diaphoretic, they're nauseous. Yeah, all types of stuff. We think because of their medical history, because they're not telling us everything, that maybe they have some sort of substance in them, but the track marks really give it away. So we don't know what they're doing. They could be taking a bunch of different things in a bunch of different forms. But at this point, we're not ruling anything out. So what do? We do a UTOX. What's a UTOX? It is a urine toxicity screen. It is a urine toxicity screen. This is your profile. This is your profile. We check for amphetamines, barbiturates, benzos, cocaine, marijuana or THC metabolites, opiates, PCP, and alcohol, right? Well, this patient has nothing detected except for what? Except for opiates. That's it, right? So yeah, but this person may not have been to their pain management or whatever primary, whoever is giving their prescription to them. And now they've got track marks on both arms. All right, now we're suspecting for sure heroin. Now we're suspecting for sure heroin. So now we look at this and we go, wait a minute. All right, we are starting to get suspicious. Now do we have a diagnosis here? And if so, what is it? What is our diagnosis? Heroin withdrawal or opioid. We'll be a little bit more broad because heroin is a type of opioid. Could they be using some other type of opioid? Yeah, of course. So opioid withdrawal. Right? No respiratory depression, right? That would be opioid overdose. Do not confuse the two. I go through this in our mental health lecture in depth. Do not confuse withdrawal with overdose. And we'll get to some questions, and I put that in here for that specific fact. All right. So now I've got my first question, my item 1 of 6 in my case study. And you can see case studies are starting to pop up a lot more. So now we've got to highlight 4 client findings that are most concerning to the nurse. So we've labeled them 4 client findings that are of concern. All right, so we've got how many options? Because when you hover over these on test day, when you hover over these, you are going to see that all of these will be allowed to be highlighted. All of these will be allowed to be highlighted. But the problem here is that we want how many of the 6 do we want? 4. Do you think I made 1 through 6? I chose those on purpose to all be relevant to opioid withdrawal? I sure did. I did that on purpose. But what is the biggest thing here in what I'm trying to highlight? The most concerning. Now you're gonna have to decide the 4 that you're freaking out about versus the ones that you are like, okay, that may or may not be as concerning. All right. So our options are, which of the 4 are most concerning to opioid withdrawal? Select all that apply. Wait a minute. Hold on a second. But Dr. Z, isn't this a highlight question? It sure is. But what if I threw? Please don't jump ahead. Please don't jump ahead. Please don't jump ahead. If I was to just put the word select all that apply right behind it, what type of a question is this? It's literally a SATA. So when I tell you that there's only 5 types of questions, and if you don't know the 5 types of questions, you should be on our YouTube channel 100%. You should be on our podcast 100%. It's the same thing. I'm just choosing 4 out of the 6. Instead of doing a check mark, I'm highlighting them. All right, we'll start with number 1. In this situation, I'm going to read all 6 of them, and I'm probably going to go back, right? I'm not going to make a decision right away because ultimately in this one, I am comparing them. And select all that apply. Typically, we try to do a true or false. But in this one, I'm going to compare because we're looking at most concerning. So the client is brought to the emergency department after being found agitated, anxious, diaphoretic. Okay, I keep that in my back pocket. Please don't jump ahead. Client is displaying muscle aches and restlessness and tremors. Okay, keep that in the back of my head. If you guys jump ahead, they are going to kick you out. They will kick you out. And then if you can't get back in, we apologize, but following directions is a big part of being a medical professional. Okay. So the third one is medical history includes chronic back pain from 15 years of working in the construction industry. The client is reluctant to disclose what medications or drugs are being consumed. 5, the client lost their job a few months ago. And then the last one is physical examination shows dilated pupils, mild jaundice, and track marks on the arms. So now we look at these and let's just try to choose ones that we think are definitely on here. Let's start with the one that you're kind of like, whoa. I think if I was to start with one of these, I think the track marks on arms for sure one of the most concerning, right? So I definitely would highlight 6. Now I look at their signs and symptoms and I'm like, okay, cool. How about agitation, anxious, diaphoretic? That kind of goes with muscle aches, restlessness, and tremors. Yeah, I kind of feel both of those are of concern. More so than the patient not telling me what they disclose. Maybe they just don't want to share, right? That's their prerogative. Maybe they don't want to disclose to you. Maybe they'll disclose to the doctor. Maybe they'll disclose to a family member. Maybe they won't disclose to anybody. Who knows, right? But do you think the chronic pain chronic back pain for 15 years is important? Or the fact that they're not trying to show us what medications or drugs? Chronic pain over the drugs. Why am I concerned about the chronic pain for 15 years over the reluctancy to disclose drugs or medications? Why? I've got 2 big clues in here. Track marks. I don't care what you were consuming. I've already got physical evidence. And now I've got a history that actually coincides with the track marks. I don't care if you told me or not, right? And I've got lab values. So you don't have to tell me anything. I already know what you're doing, right? And the fact that they lost their job a few months ago, yeah, does it help the story? Of course. But is that something of concern? No. So of these, which 4 are we keeping? And those of you that did get it right, even by jumping ahead, great job. Those of you that waited, thank you for that. Paying attention and listening and not doing things out of order is definitely something that we need to do. So yeah, we chose 1, 2, 3, and 6, correct? But do you see how that reluctancy to disclose drugs will confuse a lot of people? A lot of people are going to sit here and be like, oh, but they didn't tell us what they're taking. I don't need to know what you're taking. You're positive for opiates. You're clearly have the signs and symptoms of withdrawal. And on top of that, you've got track marks. You don't have to tell me anything. I already got enough information. We're good. And I don't really care when you lost your job, because my job right now is not about your job. My job right now is not to figure out what you were taking. I already figured it out. My job is to take care of your signs and symptoms and see how we're going to get through this withdrawal. Cool? So again, our answer choices are 1, 2, 3, and 6. And there are your answer choices right there. Cool. All right. Which of the following conditions should the nurse suspect? Wait a minute. Didn't we just go through the whole thing? Please do not jump ahead. For real, though. I mean, like, people are just going to get kicked out at this point. Like, I don't know how, I just said it like 5, 6 times, right? All right. So which of the following conditions should the nurse suspect? What type of a question is this? It's diagnostic, right? Which is, again, which one of the types of 5 types of questions? 100%, this is a freebie question. I gave you the progress notes. I told you the signs and symptoms. I gave you clues. I gave you vitals. I gave you lab results. I gave you, what's it called? The history, medical history. Now I just got to figure out what it is. Well, I was already inclined to what? Opioid withdrawals. So all I'm going to do is look for that, but I'm going to give the other ones a chance, because just in case I'm wrong, I just want to double check it, right? It is a freebie question. And Nurse Brittany, Nurse Megan, Nicole, if you want to start removing people, please do. Please do. Opioid withdrawal. Okay, well, we found what we were looking for. Okay, but I'm going to double check every other one. Methamphetamine abuse, yes or no? No, why? Give me one concrete reason. Not track marks, concrete. It wasn't detected. It wasn't detected on labs, right? They weren't positive, good. Benzo overdose. not in labs, right? Not detected. Simple. Now they're seeing, wait a minute, and it's a downer. So now, even if you didn't, let's just say they didn't have lab or UTOX. What if they didn't have UTOX in there? Take out the UTOX and say, would you still suspect opioid withdrawal? Yes. Would you consider benzo overdose? No. Benzos are a downer. They're going to slow down respiratory rate, decrease blood pressure, right? They're still going to give you that euphoria, right? And Wernicke's encephalopathy, again, we have lab values to go against this. What is Wernicke's caused by? Alcohol. Yeah, alcohol. So we've confirmed that we were correct in question 1 and our logical deduction of this scenario, correct? So with everything, everyone was able to detect or deduce that this is opioid withdrawal. We didn't confuse it with opioid overdose. Cool. So now we are confirming that it is, in fact, number 4, and it is. So again, very important to differentiate. Meth is an upper. Meth is an upper, right? So methamphetamines, right? All right. For the following interventions, mark the appropriate interventions for the client's condition. All right. Now we've got withdrawal versus overdose. Withdrawal versus overdose. All right, let's do this. Naloxone. Am I going to give naloxone for withdrawals or for overdose for opioids? This is going to be for overdose. What is naloxone known as? Brand name? Narcan. Narcan. How about tapering them off of opioids? Withdrawal, 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 withdrawal. With overdose, stop the offending agent. And okay, so here we go. Remember, too much of something. Stop the offending agent, and you should know this concept by now. Stop the offending agent and get ready to give what? Get ready to give an antidote, right? So think about this. Do we talk about this in heparin and warfarin? Yeah, we do. Right? Do we talk about this with benzos? Yeah, we do. You see, that concept is big. And I don't know if we have this as a quick tip or not, but I believe we do. We'll have to check that if we have it as a quick tip or not. So can we put that? Okay, cool. I think it's in our quick tip book. They'll drop a link to the quick tip book and all our little books and everything in here as well too. But yeah, you stop the offending agent and get ready to give the antidote. That's what for overdose. Tapering is that they're hooked on it and we need to get them off. We're not going to abruptly stop it. We're not going to abruptly stop it, right? Instead, let's slowly take them off. Slowly take them off because we're trying to avoid all the side effects, right? Are we going to give them IV fluids? Are we going to give them IV fluids? Yeah, absolutely, right? If they are in the ER, have we not already gotten IV access? Because we don't know what else we're going to have to give them, right? Which comes to my next intervention, benzodiazepines. Benzodiazepines. Would we give somebody that is coming off of opioids or is withdrawing from opioids or for somebody that's overdosing? This is a tricky one. I'm getting more overdose. If somebody's overdosing with opioids, are they going to have respiratory depression? Yes. Why would I compound that with the benzo that's going to give them more respiratory depression? I'm not. You see where I got you? See where I got you? So why do I give it for withdrawals? Are they anxious? They are. Yeah. Keep them. That was a tricky one. It was a tricky one. But again, when you think it through, because it's easy to think of benzos and think of overdose, right? It's like, okay, cool. I got you on one word. right? I just got to on one word. Benzos are going to help with their anxiety, with their tremors, right? Again, keep them calm as we're starting to get them off. What is a good benzodiazepine if we've already got IV fluids? Give me a name of a benzo. I like the brand name. I want the generic. Thank you. So lorazepam. Lorazepam is a great benzo for anxiety, for tremors, for withdrawals, for alcohol, and for opioids as well too. But again, that is the brand name is Ativan. And then lastly is monitor airway. Monitor airway. It's not both. Ooh, okay, hold on 1 second. I was going to put one, and I can see where both can, all right, good job. I stand corrected. I was gonna say for overdose, okay. But if they become tachypneic, right, where they're breathing too fast, and now they're blowing off too much CO2, maybe we got to slow them down. Okay, we got to control the breathing. Okay, great job. Wow. I told y'all I'm far from perfect, but I love it when my students teach me. That was amazing. They could be hyperventilating, 100%. Excellent job. I stand corrected. I would choose both. Great job. Wow. I'm hands down impressed by this group. Hands down. Amazing. I would take both. Great job. Wow. What an observation. So we're going to change the rationale here, but yeah, there we go. And Nclex high yield family up in here, right? We're family. There is no I'm right, you're wrong, right? There's always we are together in this journey. So I love it. So yeah, I see both sides. Excellent job. So withdrawal, because they're going to start to breathe fast. They're anxious. They're tachypneic. They're in pain, right? If we're focusing just on withdrawals, you could do IV fluids for both. Hold on 1 second. I'm gonna go back to my correction. Okay. I'm gonna go back to my original. Both would work for IV fluids and for monitor airway. However, we're talking about the client's condition, right? Client's condition. So IV fluids could be both as well too. Yeah, I would take IV fluids for both. So yeah, absolutely. I would take both. 100%. There you go. Yeah, good job. I mean, when I write these questions, even when I go on QBanks, I'll still find mistakes. So of course we're all human, right? So, but this is great. I love it. IV fluids, monitor airway. We're going to do both. I love it. Clearly I'm seeing where I made my mistakes as well too. So excellent job. So we're going to update this. So thank you for that. Look, it's kind of like a comedian. A comedian tries out their jokes to the public. And if it works, it works. If it doesn't, it doesn't. This is me trying out a question. And clearly this was needing some adjustments. So I love it. So great job. But I love the fact that everyone is thinking. That's the objective of this. Everyone is thinking and showing me that you understand. And you're not sitting there just saying, yeah, you're right, Dr. Z, because I'm not always right. Cool. Great job. Amazing. So we're going to correct this to IV fluids and monitor airway. And that would be your correct answer. Amazing job, everyone. Amazing. Makes me feel like we are making amazing progress. All right, here we go. We've got a drop down. Complete the following sentences by choosing from the list of options. From the list of options. The client experiencing opioid withdrawal is at risk for developing one of these three due to one of these three. What type of a question is this? Freebie. Yeah, drop downs are freebies. Either you know it or you don't. They're at risk for developing dehydration from opioid withdrawal, hyperglycemia, or bradycardia. Dehydration, but why? Why dehydration? What's going on with them? What are 2 ways that they're losing fluids right now? Sweating, vomiting, diarrhea. We don't have vomiting in there, but yeah, they're nauseous. Sweating and diarrhea, right? Sweating and diarrhea. Does opioid withdrawal have anything to do with hyperglycemia or blood sugars? No. Bradycardia is the opposite, correct? They would become tachycardic in withdrawals. In overdose, they become bradycardic. Good job. So we've already chosen one. Now let's figure out why they would develop dehydration. Is it because they've developed type 2 diabetes? No, that has to do with hyperglycemia. Is it because their central nervous system is hypostimulated? Hypostimulated. Hypo. It's hyper, right? Hypo. So now we've got one answer left, right? So increased GI motility and excessive sweating. So we already said why. You just had to find it. That's it. Freebie question. Straightforward, right? There you go. So I just want you to see the different words and terminology that they'll come up with, right? Because at the end of the day, I'm not going to use the same words if I can make interchangeable words. Why would I say they have respiratory depression when I can say that they have hyperstimulation of the CNS, right? I can say either or. I just want to see if you understand, because people try to memorize words and then it's no good. It's no good. All right, let's continue on. So those are our answers. Thank you. I appreciate that. I appreciate the compliments, even though I made a mistake today, but hey, we're all learning. We're all learning. So great catch. Now we got a select all that apply in front of us. Again, these are the same types of questions that I've taught, the 5 types of questions. It doesn't change. Which of the following are common withdrawal symptoms of opioid addiction? All right. Do we get bradycardia? No. How about anxiety? Yes. Euphoria? No. Muscle aches? Yes. Nausea? Yes. Again, think of what opioids do. If you think about what opioids do, now take it away. If they make you euphoric, are you going to become anxious? Yeah. If you're like cold and pale and relaxed, are you going to become hot and sweaty and agitated? Yeah. If opioids make you constipated, then I take away opioids. Am I going to have diarrhea? Yeah. If opioids take away my pain, am I going to have pain or muscle aches? Yes. You see, it's very simple. If you think about it, if you know what the medication does, then you know what the withdrawals are going to cause. Very important. You're not going to be euphoric if I take away withdrawals. You're going to be agitated and anxious, right? If I'm taking opioids, I'll be like, oh, I'm so relaxed. I feel so good. Thank you. Right? My heart rate when I take opioids is going to drop. When you take it away from me, it's going to go up. Cool. All right. We have no clue, but we are working on it diligently. So, all right, here we go. Which interventions are appropriate for managing opioid overdose? Hold on one second. This whole time, 5 questions. What did I talk about? All 5 had to do with what? Withdrawals. What did I just do to you right now? I flipped it. I flipped it on you now. And right now, I just got you 5 in a row on withdrawal. And on the 6th one, I've got you trained mentally to think about withdrawal. And now I just switched it up on you. That's why I say read every question all the way down to the last word, because I did this on purpose. How many people that are not part of Nclex High Yield, that don't have new questions written for them, that don't think like this individual right here, a little off the wall, a little atypical, but you don't think I trained your mind to think a certain way, and now I flipped it up? Now you're going to get 0 out of 5, or most people would, that aren't part of Nclex High Yield or that aren't part of this community, because they aren't looking for me to flip it on them. But I got you trained to think about withdrawals, and now we're going overdose. So let's think about which interventions are appropriate for overdose. Fluid restriction. No, not at all. For overdose, do we want to make sure that their airway is open? Yes, we do. How about monitoring their vital signs, their blood pressure, their heart rate, their respiratory rate? Yeah. Giving them additional opioids? No. They're already overdosing. Why would we give them more? Why would we give them a benzo? I should have thrown right here, prescribing benzos. And now watch, people would have been like, wait a minute, I'll go back to withdrawal real quick and I'll choose it. That actually would be a good question right there to trick people up. But you're not going to give either or. Administering naloxone. Yes. Pretty cool, right? When you start to think like me, it's different. It's different, right? That's why people start to see the test in a different light. All right. We got time for a bow tie. We're going to go through the next two pretty quickly. So bear with me, because I don't want to leave you without going through these, because they're fun. All right. An 8-year-old child is brought to a clinic by a caregiver. Did I give you an age for a reason? Yeah, you better believe it. We're in pediatrics now. Now I'm in mental health, and I went to pediatric mental health. Whoa, okay, let's see. The nurse notices multiple bruises with different stages of healing on the child's arms and legs. Okay, bruises. Do we have any broken bones here? No, I just said bruises. I didn't say broken bones. The child appears withdrawn and avoids eye contact. Okay, what is my thought process right here? Child abuse, but why? Why can't this be like they're sporty or they're clumsy? The eye contact, good. The withdrawn and the eye contact, right? There you go. And what is the other clue in there? A big one that you'll see for child abuse. Different stages of healing. Remember those words. Different stages of healing. So do we have a diagnosis right now? What's our diagnosis that we're thinking? Child abuse. All right, let's see where it comes out. With the bow tie, where do we start? What's my first place I'm going to start? The middle. Because once I can find what I'm looking for, then, all right, maybe I'm a little bit more inclined to picking the right answers. Vitamin deficiency, now we're going to use a method. Vitamin deficiency or dermatological condition. Okay, multiple bruises versus vitamin deficiency, which kind of maybe like rickets or calcium deficiency, bones. No broken bones. So maybe of the two, 3 over 4. I like the way that y'all are answering it, because now you're using the method. I would choose 3 over 4. Now I compare 3 to 2. Child abuse, oh, we were thinking this. Now we compare that to 3. So now we choose 2 over 3. Excellent way of using my method. Lastly, accidental injury or child abuse. Again, using the method, we've now come down to, but could it be a dermatological condition? No, because we chose child abuse and eliminated 3. Are we going backwards? Are we changing our answers? No, we're not. Now, which side do we go to? The left side. action to take. So my options are, we start with number 4. Now we're going to do a true or false. This is action to take, select all that apply. How many am I selecting out of select all that apply? 2. Is this not just, this is what? This is a freebie question, right? So this is a freebie question, diagnose it. Now these are going to be select all that apply, but I'm only choosing 2. Select all that apply, choosing 2. How does a bow tie differ from the 5 types of questions I've shown you? They don't. How does a case study differ? It doesn't. When I told you I figured this out, I figured it out. I may not have figured out IV fluids and respiratory should be monitored for both, but I did figure out the rest of that. So nonetheless, are we going to do CPS, contact CPS, Child Protective Services? Yes. Okay. Educate the caregiver on normal child development. If we suspect child abuse, no. Perform a detailed physical examination. Yes. Provide routine examinations. It's not my concern right now. My concern is 2 and 4. What am I going to monitor? Select all that apply. Choose 2. Am I going to monitor their vaccination records? No. Safety of the child's living environment? Yeah. Child's emotional status? Yeah. Nutritional status? Why did I throw this in here? Is this abuse or is that neglect? Vitamin deficiency? It could be very confusing, but which one is more important right now? Abuse, right? So we're looking at the emotional status. So yeah, so very interesting choices. Nutritional status can be considered neglect, which can fall under abuse, but right now, they didn't give us an indication of any type of nutritional deficiency, right? But we did give the withdrawn and the eye contact, which means emotionally something is wrong. So we go with 2 and 3. Thank you. 2 and 3. 2 and 3. Thank you for that. All right. So that's a bow tie. Again, it seems simple, but again, look at the people to the right of you and the left of you. They probably don't have the extent of knowledge or test-taking strategies that I'm providing you. So very important that we do that, right? Very important that we take that. All right, last question. So I haven't really done many of these for the Zoom, but we're going to go like maybe a minute or 2 over. It's going to be real quick. So now arrange the following interventions in order of priority for a patient with opioid overdose. Hold on 1 second. Is this a prioritization question? Nope. Is it select all that apply? No. Is this a further teaching, further intervention? No. Is this a freebie? No. What does it fall into? Or miscellaneous? You could do priority, but yeah, ultimately it's kind of like the format is a miscellaneous. The concept is prioritization. So now we got opioid overdose. So let's look at these. We can administer naloxone, monitor vital signs, ensure airway, call for help, or provide supportive care. So what are we going to start with first? Prioritization, ask graph, right? Is this not straight up an ask graph question right there? Ensure airway. Now, what am I going to do next? What do I teach you? I teach you progression, right? Everything I teach you is progression. So am I going to give naloxone, vital signs, call for help, or supportive care? If this person's airway may be compromised, do you think I want to do all this by my own? No, I don't. I'm going to call for help because they're not saying that they may have opioid overdose. Did they say they're suspected of opioid overdose or have taken some opioid pills? No, they're saying they have opioid overdose. So yeah, get that airway good, call for help. Now what am I going to hit them with? Get them the antidote. I got their airway. I called for help, for somebody to help me do everything else, because I don't know how severe this is going to get and how quickly it's going to get severe. Administer naloxone. Get them to, boom, pop right back up. Anybody ever seen naloxone being administered? Whoo, you'll see that person, boom, they're up. Now, between supportive care and vital signs, what am I going to do? I'm going to check the vital signs. And then I will continue, once I've got them stable, I will continue with supportive care. What do you guys think? Kind of cool? Kind of cool? Kind of cool? Did you guys enjoy? Yeah? All right. So with that said, look, I only ask for one thing only. Please, please, please put your cameras on, cameras on, cameras on. I am going to do my usual video. All right. What's up, everyone? Dr. Zishan here, another free weekly Zoom. We did some bow ties. We did case study questions. We even did an order question on mental health. It was amazing, amazing, amazing. People even corrected me where I was wrong, which was hands down showing me that our community is learning and learning and learning and knowing what to do. Because all these beautiful people that are waving at you, waving at you, there you go. Got a free education on another Wednesday. Because if you're not here on a Wednesday, what is you doing? Until next week. See y'all then. Take care. So with that said, look, if I did anything to offend anybody, I apologize. If I can get better, please let me know how. Thank you so much for joining me on another Wednesday. I will see y'all next Wednesday as well. Please, please, please help us spread the word. Reddit, Facebook, Instagram, whatever you got, just please help us spread the word to your friends, to your cohorts. We appreciate it. We love to see more and more people joining us every week. And I'll see